Hi everyone, this is Mrs. Grapaldi. We promised you a little video on med administration using the SimCab, SimEMR, and Meds Manager. So I'm going to run through this. I'm here by myself recording, so I may need to move the camera around a little bit. So if it feels a little disjointed, I apologize. I just want to make sure you all can see everything. All right, so the first thing I'm going to do is come into the room. I have the paperwork that I'm going to give my instructor who's checking me off. So I've got my lab check sheet, I've got my med templates, the multiple pages, and I've got my signature log. I'll hand all of that to the instructor. Instructor is going to check your med template and return it to you, and you will use that as your drug guide throughout the process of giving medications. At this point, you may also tell the instructor what the 6 rights of med administration are. Documentation comes later, but you can also cite that right now so that we know that you know what's going on. Okay. The instructor is then going to give you your patient assignment. So in this case, I've been told that I'm going to give the morning meds for Kenneth Bronson. Mr. Bronson's the patient we all have come to know and love. So I will log in, come to the med cabinet, and I'm going to log in. I'm going to log in as a learner. I have 2 accounts, and I can do this so that you are able to see a screen similar to what you'll see. So this is where it opens. Now you may have that tutorial tab. If you do, you can eliminate that or just move past it and make sure you click the patient portfolio up here on the screen. The other thing I want to do, I want to go ahead and log into Meds Manager, so I have both programs open. Remember, SimEMR is the patient record. Meds Manager is where we're actually going to give meds. That's like our dispensing cabinet. All right, that's going to take a minute to load. And I'm going to click on the left-hand sidebar menu, I'm going to click on Patients. That's going to bring up the patients I have assigned and available to me. So I'm going to click on Kenneth Bronson, and there we have his med administration record. I need to check his orders to make sure they are accurate, and I can do that by clicking Swap View up here on the green button. And I see that I have 75 milligrams of metoprolol that he gets daily, and 100 milligrams of colace that he's going to get daily. I'll click Swap View and double check what I have. So I'm going to be giving metoprolol 75 milligrams daily, colace 100 milligrams scheduled for daily. All right, now I know what these medications are, and I think to myself, I can talk it through in my head. This is the perfect time to talk with your instructor about these medications. So when I'm talking about the medications, I'm going to use my med template, and I'm going to verbalize metoprolol is a beta blocker. Okay, metoprolol is the generic name. It works by protecting the beta receptor sites on the heart. As a result, I need to check heart rate and blood pressure because it can lower both. Okay, 75 milligrams, I'm looking at my med template. I see that it is within safe range for this particular patient, my adult patient. Okay, significant side effects can be hypotension, bradycardia are the 2 most significant things that can happen with this patient. For nursing implications, I think about the issues with safety. So if my patient's blood pressure drops, if they become hypotensive, think about the fact that they can fall and hurt themselves. So those are the kinds of things I want to consider, okay? This is certainly not everything that's on your med template. I'm just giving you a quick example. So my nursing considerations would be, making sure I teach my patient. You may become dizzy if you try to stand too quickly. We are here to help you. Please call us if you need to be out of bed. We are glad to come and help you. Administration concerns, so if there's any kind of issue with this medication, I would identify it and then I would move on to the other medications that I will be giving and do the same with each of them for your instructor. They may ask you additional follow-up questions. You do not have to memorize it. Please use your med template to go through that and make sure you understand what you're giving, okay? Next thing I'm going to do is to, now that I know my medications, I know my parameters, I am going to stay logged in, but I will tell my instructor, I'm going to stay logged in, but normally I would log out of both programs because of security reasons. But for now, I'm going to stay logged in for time's sake. Now I'm going to turn the camera and we're going to walk to the patient's room. It's time now to go to the patient's room, so here we go. So turning the camera, walk, going to see Mr. Bronson. Okay, knock. Come in. Hi, I am Debbie. I'm going to be your student nurse today, and I'm going to be giving you medications. But before we give you medications, I thought I'd take a few minutes to introduce myself, to see if you have any questions, check and see how you take your medications and so on, okay? Oh, that's good, that's fine. Also, this is a side note to you guys, if you have a pill cutter in the room, this is a good time to clean your pill cutter, and you can leave it drying while you go to get the medications. So for now, I'm going to perform hand hygiene, and I'm going to ask the patient to identify himself. Yeah, I'm Kenneth Bronson. My birthday is 9/5. I look at the ID band. Yes, that's what I have there. So, Mr. Bronson, how are you feeling today? Oh, yeah, I'm fine. Just happy. I wish I was going home soon. So I'll be happy to get out. Are you having any pain? Any discomfort? No, I'm good. Okay, so the medications we have to give you are your metoprolol and Colace, which is a stool softener. So the metoprolol is your heart medicine, and it affects your blood pressure too. And we'll talk a little bit more about that later. And then your stool softener. Yeah, I could use both. Okay. So how do you normally take your pills? Well, I just swallow them all down. I can take them whole. Do you take them one at a time? No, I just take them all at once. Okay. Do you have any allergies? Nope, no allergies. All right, good. So I'm going to go ahead and log in to my Meds Manager system over here. This will be up for you guys, so you just go ahead and log in. The reason I'm having you log in now is it's going to save you a bit of time when you come back to the patient room. Normally we would wait until we have the medications with us to log in, but this will save time and it can be loading while we're going to get our meds. All right, my cutter, I have at the bedside. I'm going to go ahead and clean my cutter with some alcohol. Please don't cut yourself, be very careful. All right. I've cleaned my cutter. I'm going to set it over here on the side table. And, all right, Mr. Brunson, I see you have some water here. Is that how you normally take your medicine? Yes. Okay, I'm going to go get your pills, and I'll be back. Okay. So now we're going to turn, guys, and go back to the med cabinet. All right, so this is where we're going to do our first and second checks. Hope this is showing up okay. Let me adjust the camera a little bit. All right, there you see it. Okay, so I have Mr. Kenneth Bronson. He is getting metoprolol, 75 milligrams. What I have available are 50 milligram tablets, so I know that I'm going to need to pull 2 tablets and cut one of them. The other one is Colace. He gets 100 milligrams. What we have available is a 50 milligram capsule, so I need to give 2 of those in order to meet the dosage. Okay, so those are the 2 I'm going to be giving right now. I know that I need to check heart rate and blood pressure on the metoprolol, so I'm going to come over here and click over to the SimEMR, so the patient's medical record. I'll I'll find my patient on the list. I'll go patient. And I'm going to come to, actually vital signs are posted here, so I can click here and look at the vital signs. And then I'll say, okay, his pulse that I took just a few minutes ago was 86. His blood pressure was 140/78. So I'm good to go with the low pressure. I can give that safely. If I have labs to check, I will click here on the labs, look at the labs. There's nothing available to show right now, but if I did have labs, it would be there. If there's any other parameters I need, I could check here and find them here. If I had questions about the patient's I's and O's, for example, if I'm giving furosemide, I might want to know the I's and O's, how they're doing with that. I could take a look here in the I's and O's, and there would be some information available for you. All right, so let's move back to Meds Manager, which is actually our MAR. So our MAR is right here. So now I'm going to start by clicking on the medications I wish to administer. So I'll click on Administer. The drawer will pop open. I find the medication. I'm going to tip the camera. I find the medication in the drawer. I see that I have metoprolol 50 milligram. I need 2 of them, so I'm going to pull 2 out of the cabinet. There's the other one. Okay. I have metoprolol 50 milligram. The expiration is good on each. The package is intact on each. So that's my 50 times 2 is 100. I need to cut one of the pills, so I end up with a 75 milligram dose. So there we go. And then I'll close this drawer. And it's telling me to scan. So at this point, I'll scan each medication. And then I will fill in the dosage right there. So I'm going to give 75 milligrams. So I'll go ahead and put that in. Notes, I could say 1.5 tabs. And then put my initials. And then save. Okay, the next medication I'm going to pull is my Colace. So I'll click on that. It's going to tell me to scan. So I need to find that medication in the drawer first. So I'm tipping the camera so you see the drawer. I think you can see the drawer. And I'm going to pull Colace. I'll close the drawer. We'll come back up and I'll look at the Colace. And I'll say, I need 100 milligrams of Colace. What I have are 50 milligram capsules. So this is a 50 milligram Colace. This is a 50 milligram Colace. Expiration is good on each package, and the packages are intact. I'm going to go ahead and set this here, and I will scan my medicine. All right. So dose given is 100, or to be given. Notes is two capsules. And then my initials, DG, save. First check done. Now that I have that finished, I'm going to take my medications and I'm going to compare them directly with the MAR again. So my first medication is 75 milligrams of metoprolol. I have available 50 milligram tablets. Here are the 2 tablets I'm comparing. Lopressor 50 milligram, expiration is good, package is intact. Metoprolol 50 milligram, expiration is good, package is intact. I need to cut one of these, so I'm going to put that in its separate little cup, so I remember to do that in the room. That's second check on that med. Next medicine is Colace, 100 milligram. What I have is a 50 milligram tablet here. Expiration is good, package is intact, but I need 2, so here's my other medication. 100 milligram Colace is needed. What I have here is a 50, so I need to give 2 to get the dose. Expiration is good, package is intact. I can put that in a separate cup. All right, I'm done. I have my parameters. My heart rate was 86. My blood pressure was 140/78. So we are good on that. I didn't need any specific parameters on the Colace, although I could check the I's and O's. As I said, you'd click here for the I's and O's. That's in the patient record in SimEMR. So going back to Meds Manager, once I'm satisfied I've got everything I need with my second check done, I will log out. Excellent. Now we're going to take our medications, got our meds, take our med template with us, and we're going to turn and go back to the patient room. Okay? So here we go, back to Mr. Bronson's room. If the camera's bouncing, I apologize. So let's make sure we have a good view of the work area here. I'm going to get a little tip on the camera for you guys. I think that's a little bit better. You can see the table, you can see the computer, you can see the patient. Good morning. I'm Debbie. I'm the student nurse who's going to be working with you today. We met a few minutes ago. Oh, yeah. Come on in. Okay. So I've done hand hygiene, and I get ready to give my medications. So I have your medications for you. I need to do a quick check on the computer, and then I'm going to ask you to identify yourself again for me, and I have a couple other questions. Okay, fine. How come you have to keep identifying me? Don't you know me? Well, we need to do that because we want to make sure everybody is safe. So we have a lot of patients who we care for, so we want to make sure that you're safe and we're giving the meds to the right patient. Okay. All right, so can you... So we've logged into the computer. I'm going to pull up the patient list. Okay, I'm going to pull up his record in Meds Manager. Can you state your name and date of birth for me, please? While he's telling me, I'm going to scan his ID band. Yeah, it's Kenneth Bronson. My birthday's September 5th. ID band matches what he's saying. It matches the medical record. I'm checking in the computer. It's got the information right here, and it's matching. Great. Okay. So I'm going to go ahead and do my third check. So I'll bring my medications over here, and I'm going to compare to the MAR. So what I have is low pressure metoprolol. I need to give 75 milligram. What I have is a 50 milligram tablet. Expiration is good, package is intact. I have another 50 milligram tablet, expiration is good, it's metoprolol, package is intact. I'm going to set that to the side because I need to cut that. Then I'm going to do my third check on my Colace. So I have Colace 100 milligram, what I have is a 50 milligram capsule. Colace 50 milligram, expiration good, package is intact. Colace 50 milligram capsule, package is intact. And while I'm doing this, I can actually be scanning the medications also. So I scan that med, scan that med, good there. And I scan these meds as I'm checking. Scan these meds. All right, so we're good there. Come over here, it's a little easier to work on this table. And let me see if I can move that so you can see. All right, so this is my Colace. This is my metoprolol. This is the one that I need to cut. I am going to put gloves on. I somehow can't seem to cut a pill without touching it, so I always put gloves on when I have to cut. All right, so Mr. Bronson, I have the pill for your heart, the metoprolol. It affects your blood pressure a little bit too. So we're asking you when you get out of bed, if you would please call us. Don't get out of bed without calling us. We want to keep you safe. We'll come and help you. Okay, fine. All right, so here's my pill. I'm lining it up to the score mark. Snap, crush. About half a pill I can put in the container there. I'm going to go ahead and open my others. And since he said he can take all of his pills at once, I'll put them all in one container, in one little cup. Sometimes these capsules will stick to the inside of the packing, so sometimes you kind of have to peel them off. right, Mr. Bronson. And you told me you have, what are your allergies? No allergies? Okay, good. All right, so here's your medication. If you want to go ahead and take your medication, great. Here's your water if you want to go ahead and sip your water. All right, did they all go down? Everything good? Yeah? Okay. So I'm going to come back in about an hour to check on you. But in the meantime, if you have any problems, you let me know, okay? So, guys, that's the end of the med administration. His bed is down. He's back in a comfortable position. I'm going to go ahead. All of the pills that you use, including the one you cut, can go into the sharps for our purposes, okay? And then I'm going to take my gloves off, hand hygiene, log out of the computer, and we are good to go. Remember, your 6th right documentation takes place as you're scanning the medications. So I'm going to post this. If you have any questions, please let me know. I'll put a discussion board up. Otherwise, you're going to do great. Remember, we're concerned more about your ability to safely give meds, not your ability to maneuver the cabinet, okay, the med cabinet and the computer. All right? You've got this. Have a good weekend. Talk to you later. Bye.